Humerus, not coming from the word humor. Previously, it is told that whenever you make a short hair, suddenly our jerks, so it is humerus bone, but that is not true. So, কি করে আমরা পড়ি বোন, যে কোনো বোনস পড়তে গেলে যখন ওরাল টেবিলে you have when you appear, there must be definite question from the bone itself, but there might be a question associated with general anatomy, because there is a no other scope or other tables where the examiner will ask the general anatomy, right? So you have to have an idea about the general anatomy of the particular bone. If it is a humerus, so what is the general anatomy of the long bone? The types of joints, this is a scope where the examiner can ask you. So you have to know first it is a humerus, but when you ask what is the bone, you say, sir, it is the humerus. It is an incomplete. Why? Why incomplete? Right and left. You must complete the word by right and left. Right humerus, left humerus, whatever it may be. So you have to know the side and side. Second question, so my rule is that superior, inferior known by, anterior, posterior known by, lateral, medial known by, and lateral will tell the side. Clear আসবে? Next হচ্ছে so it is a bone of superior extremity. It is a long bone. So it is a long bone. Then question the general anatomy. Why call you long bone? What are the characteristics of the long bone? You tell, sir, the length is greater than breadth. Sir, there are shaft and two ends. Examiner interrupt you and tell, what are the ends you call? So shaft is the diaphysis, ends we call the epiphyses. Examiner will go to the question of epiphyses. What are the different types of epiphyses? Pressure epiphyses, traction epiphyses, adaptistic epiphyses, aberrant epiphyses. In this way the question go. I am not going into details. So the long, in this way it will come, the characteristic of the long bone. Next, as it is a humerus long bone, it is a superior extremity bone. So it articulates with one end with the scapula and other end radius and ulna. So it is the arm, it is the arm, it is the forearm. So arm bone is single bone, humerus. Forearm bone, two bones, radius and ulna. So the side determination, the above below known by. So before going to the above below known, above globular head. Below there is an pulley shaped trochlea. Above, the most important is a globular circle of a head. Above, it cannot be such, because here the head is below. So you must put the above. Anterior, posterior, very easy. Anterior and posterior, you look the lower end. You look the lower end. In the lower end, you look the posterior side. There is a single depression, fossa. Single deep depression, fossa is there. We call it Olecranon fossa. It should be always downwards. And there are two shallow depression, coronoid and radial fossa anteriorly. আমরা একটা দিয়ে করি. So anterior, posterior known by the deep fossa, Olecranon fossa. So it cannot be such, so that the posterior side become anterior. No. So this is the side. Then is the lateral and medial. Head looks medially. So if head looks laterally, other side is the lateral. So whenever head looks medially and put it in the anterior, posterior, it cannot be. So the head looks laterally. Here it fits. Look, head looks medially towards my midline. So lateral কোন দিকটা? This side, right side. So it is the right bone. Next, a tricky question. সাপোজ, এটা তোমরা কালকে বলবে, আজকে বলবো না, only police has given a bone has been found in the ground, only the upper end is given. How do you know which side? অ্যাবাভ দিলে তো বুঝতে পারবে, anterior, posterior, lateral, medial. ভেরি গুড। আর্টিকুলেটের সাথে সঙ্গে লুকস, এখানে হচ্ছে কোন দিকে লুক করবে, অ্যান্টিরিয়ারলি, পস্টেরিয়রলি, অ্যান্ট্রোল্যাটারালি, পস্টেরিয়রলি। যদি অ্যানাটমিক্যাল পজিশনে দেখো, ল্যাটারাল মিডিয়াল আমরা কি করে বুঝবো, এই বাইসিপিটাল সালকাস, ইট লুকস ল্যাটারালি, আর লেসার টিউবারকুল লুকস অ্যান্টিরিয়ারলি। সুতরাং আমাদের এইটুকুনি দিলেও আমরা বলতে পারবো।